Well, hey, it is flu shot season again. The Centers for Disease Control and Prevention is recommending you get the shot and get it soon. Joining us now to talk about that and what the flu shot will protect you from is Dr. Bill Hartman, clinical trialist at UW Health. Is there a best time, Dr. Hartman, to get the flu shot? Like, can you get it too early or too late?
You can probably get it too early. Really, we're looking to get the flu shot sometime between mid-September and the end of October. You have to keep in mind that it takes about 2 weeks to be, or for that shot to fully work, and so you'll get it. A couple weeks later, you'll be immune against the flu, at least the circulating flu strands that are within the shot. And so, really think about getting it now. Towards the end, into the end of October, so that you can have that immunity going into the full-fledged flu season.
I know a lot of times doctors look at how Australia fared during its cold and flu season because they run everything, 6 months ahead of us because they're on the other side of the world. How was their season? Like, are we making any sorts of improvements since rebounding from COVID and all the kids finally being exposed to germs again?
It was a pretty typical flu season in Australia, and that's what we're predicting here. It's important to note, though, when they make these flu shots, it's really a best guess. And so sometimes they're spot on, and you can get up to 80% effectiveness, but other times it's a little bit less effective than that. Still, the best way to protect yourself against the flu, the upcoming flu in the flu season, is to get the flu shot.
All about being proactive. And speaking of that, mammograms, right, are recommended for all women of a certain age, but false positive test results seem to have an effect on women getting screened at a later date. What's going on here?
I think women get frustrated by the fact that they would get a false positive. False positives in mammograms can occur up to about 10% of the time, but it's important that we realize that false positives aren't a bad thing. What we're trying to do is limit the number of false negatives that are out there. We want to, when the stakes are this high, make sure that we capture as many of the cancers as we can with these screening tests. And false positives are going to be part of that, just so that we can get the maximum number of cancers caught in time so that they can be treated and something be done about that.
Do you think it's the frustration with the emotional roller coaster that these false positives put women through?
I do think that that's part of it. I think that that frustration is real, but we have to remember that breast cancer is a leading cause of cancer, leading cause of death in women, and so we have to be able to capture these cancers. The only way to do that is through these screening mammograms.
And having this technology, I mean, it is a lifesaver for so many women out there. Dr. Hartman, we always appreciate it. Thank you.
Thank you.